Anxiety is a normal reaction for a variety of life's memorable and mundane moments. An upcoming driver's test, public speaking event, first kiss, or important job interview often compels reactions such as increased perspiration, raised heartbeat, and hyper-awareness. These signs of normal anxiety fade and then disappear along with the event that brought them to life. Abnormal anxiety manifests frequently with heightened discomfort that regularly originates from events that don't merit them. About 40 million Americans suffer from abnormal anxiety. Symptoms of abnormal anxiety regularly consist of difficulty focusing, restlessness, fatigue, irritability, insomnia, thoughts of worry, and panic, and more. It frequently manifests into an anxiety disorder that may require treatment by an experienced psychologist or psychiatrist. Examples of disorders that stem from abnormal anxiety include separation anxiety disorder, panic disorder, social anxiety disorder, including social media, and generalized anxiety disorder. If symptoms of an anxiety disorder persist in intensity or disrupt daily life, consider scheduling a visit with a medical health professional. Many people seeking relief from the agony of anxiety disorders they are unaware of turn to benzodiazepines. When not obtained by a prescription from a doctor, benzodiazepines are referred to as benzos, downers, chill pills, french fries, and blues. In the short-sightedness of only relieving symptoms, sufferers have found that benzos temporarily alleviate their symptoms by helping the neurotransmitter responsible for soothing anxious thoughts in the brain. This can be dangerous, as benzos are prone to initiating addiction and/or potentially fatally overdoses, especially if a medical professional doesn't supervise dosing. Anxiety disorders require careful and professional treatment by a doctor in order to successfully manage symptoms long term. Self-medicating with benzos risks additional psychiatric consequences. In addition to addiction, long-term use of benzos can cause cognitive impairment such as reduced memory function, learning abilities, and sensory perceptions. Regardless of whether or not one has a prescription, long-term benzo use is not recommended for these reasons. If you've been taking benzos for a significant period of time, you may find that stopping your use isn't as easy as it sounds. It can bring on insufferable symptoms such as muscle and joint weakness or pain, trembling, confusion, dizziness, insomnia, panic attacks, depression or anxiety, stomach pain, blurred vision, and headaches. These symptoms, especially after abrupt use or abuse of benzos is terminated, indicate that the medication is no longer alleviating the symptoms of an anxiety disorder without great risk of injury to your physical and psychological health. Addiction doesn't have to be the price you pay for managing an anxiety disorder. It's possible for you to enjoy your life free of addiction and the disabling symptoms of an anxiety disorder. Let us help. Many of our treatment centers specialize in treating co-occurring disorders. Co-occurring disorders is a term used to refer to an addiction that occurs alongside a psychiatric disorder. Two or more psychiatric disorders present in one brain react to one another, enhancing the adverse symptoms of each one. Recent studies have shown that treating co-occurring disorders simultaneously is the most effective way for sufferers to gain control of their symptoms and their lives. Our mental health therapists develop specifically tailored treatment plans for each of our patients to ensure that we maximize our support in their efforts to become healthy again. We are committed to facilitating an effective treatment plan that promotes and enhances long-term recovery from both or all psychiatric conditions. Give us a call today. We're standing by to guide you to the most suitable path to psychiatric health for a lifelong practice in recovery.
Please feel free to comment, like, or subscribe to our channel.